afternoon, Facebook. You are joining us for a brand new segment that we just are kicking off today with Dr. Chris Mullenix. He is with us. He is an oral surgeon in Mobile. It's called The Doctor Is In. And so every week we're going to be delving into different medical topics. And today we're talking about one that is really interesting. I mean, when you think about all the advances of technology and what you can do for people now, I mean, it's just night and day, you know, from years ago. And so today we're going to be talking about, first off, whatever you want, Facebook. So if you have a question about something like dental implants or wisdom teeth or anything that an oral surgeon does, type your question right now, and you've got the doctor at your disposal to ask your questions, or maybe people can even post a picture of their own mouth. Absolutely. If they go, can you help me? We'd love to see that too. So this is your time for the next 10 minutes or so. We're going to be talking with Dr. Chris Mullenix. All right, so let's talk about dental implants. Absolutely. Something that didn't exist years ago. Correct. And now you're doing this all the time and helping people with, really an embarrassing problem. A lot of people are missing teeth because they have fallen, they have a sports injury, they weren't born with certain teeth, and so people are watching what in the world is a dental implant.
Sure. Dental implants have actually been around for about 50 years
now. Oh, really? Okay.
Correct.
Okay.
The technology has improved in the last 20 years. I've basically been placing them my entire career. And it's essentially a titanium screw. It has threads on the outside that grab the bone. It has internal threads that receive attachments, and that allows us to build a natural looking tooth, to put multiple implants in to replace multiple missing teeth. You can replace an entire arch with teeth.
Wow.
You can anchor existing or new dentures. It's even gotten to the point where we can bring a patient in with no teeth who's been missing teeth for decades, place implants, and a denture can be bolted onto those implants in the same appointment.
Oh, that's unbelievable.
Yeah,
so
it can be life-changing.
Wow. So the post or the screw actually goes into the jawbone.
Correct. So the implant itself is screwed into the bone, and we prepare the bone with small drills. And people think it's a big process. It requires planning. It requires expertise, but a typical implant placed in my office takes about 15 minutes.
That's it?
That's it.
Wow.
So, if you're getting multiples, and we can place multiples at one appointment, certainly the time can vary, but it's, for the most part, quick, simple, and painless.
Okay, so I'm going to follow along with this on Facebook to see if anybody has any questions just yet. All right, let's take a look at some of the comments that we are getting right now. All right, well, do you do anything for TMJ?
I have a limited TMJ practice. I do see patients and do non-surgical treatment.
Okay.
But I'm happy to refer them to Birmingham. TMJ is a very complicated problem, and there are a couple of physicians in Birmingham that really specialize in TMJ, and that's where most patients are best served going.
All right, well, I want to show that graphic that the pictures that you showed, that you brought in to show people what exactly we're talking about here. So if you guys could just pop up that graphic. So this particular picture here, this person was not born with two of their front teeth.
So they were, the term is congenitally missing lateral incisors, and this is a problem that I will see several times a year. More females than males, believe it or not. And as you can see, going through life without two of your front teeth is a real problem. Now, in the old days, traditional dentistry would do either a removable partial that snaps in and out, and can lead to damage to adjacent teeth. Aesthetically, it's compromised. Functionally, they're difficult to chew with, so patients do not like those.
Right.
But it's an option. The other option is called bridge work, where you actually file down the natural teeth, the bridge glues in, they look good, they can last a long time, they can function at a high level, but essentially you've damaged additional natural teeth. And when that fails, not only are you missing the initial two teeth, but potentially 4 more teeth. And so the advantages to implants: they don't affect the surrounding dentition. They help to maintain the soft and hard tissue so that it doesn't continue to resorb or collapse over time. They look like teeth. They chew, technically they chew harder than natural teeth because they're fused to the bone. And they can, in most cases, last a lifetime.
That is amazing. A lot of people are asking, are these covered by insurance? Insurance
is starting to cover them. Some of the blue plans cover them. Some Delta plans cover them. We try to make this affordable. We want patients to be able to get it. We actually offer financing for these. Most of the time we can figure out a way to get this done if the patient wants to do it.
And so we've got a lot of questions here about the average cost.
Sure. An implant in this area is between $1,600 and $1,800 a piece. An implant and a crown is approximately about $3,000. the cost of a bridge, which is the other alternative for 3 teeth, is approximately $3,000.
Wow, okay.
So financially, it's really a push. You can do either one from a financial standpoint. And in most cases, not every case, but in most cases, the implant is superior.
Okay, so let's see about some of the other questions that we are receiving. Why don't we look at another picture? Because we have a picture of a young woman who actually had a sports injury when she was a little girl.
Correct. So she had a tooth that was damaged. It was treated with traditional dentistry with a root canal and a crown, and it survived about a decade. But as she reached adulthood, the tooth became infected. The tooth fractured, and it had to be removed, which left her with a missing front tooth. Again, very good hard and soft tissue, perfect adjacent teeth. The best long-term solution for her, a dental implant. And as you can see, the finished result, when done properly, imperceptible from a natural tooth.
I know, you really can't tell.
Correct.
That is
beautiful.
And so as far as people are asking, does this hurt?
You know,
no, it doesn't have to hurt.
Well, a lot of patients, I'll remove their natural tooth and place a dental implant. And almost 100% state that the tooth extraction was more painful than the implant placement.
Oh, wow.
So, believe it or not, it sounds traumatic, but for the tissue, in the way that we do it, it's very atraumatic.
Atraumatic. Okay, that's a new word. Atraumatic, without trauma.
That's
okay,
exactly.
But you offer general anesthesia if it's needed in some cases.
Well, I think that's one of the reasons that it is painless in our office. We offer not only local anesthesia, which is numbing of the tissue, but we offer deep conscious sedation and general anesthesia. So
when would you need to use general anesthesia?
Bigger cases, severely apprehensive patients, anxious patients. Some patients are on medications that don't allow a very smooth sedation, and so we kind of tailor it to the patient's need. And the wonderful thing for me is we have the ability to offer them any type of anesthetic they may need.
In your office? In
the office.
Okay, that is very good. A lot of people are asking here about the recuperation period.
Sure. You know, it varies on the case. We're talking in these cases where we're simply placing implants. I usually tell the patient, take the day off.
Okay,
give yourself a couple of days afterwards for soreness. Now, I do more extensive cases that require bone grafting and so forth, and some of these implant surgeries require stage surgery where we do grafting first to replace missing bone, missing soft tissue, and then come back and place implants as a second stage. And so those are bigger cases. They can require more recovery. Some of the things I do require a week or more to recover from.
Okay.
But not most of the time.
But we have to stress to people, though, it's not like you go in one day and the next day you have this perfect tooth.
Correct.
I mean, this is a 6 to 8 month procedure.
For dental implants, long-term, absolutely the best solution. Short-term, the only disadvantage is there is a healing period. The way the implant works is the bone actually grows around the threads of the implant, and titanium fools the jawbone. It thinks it's bone, and bone fuses to that surface. Just like if you were to break your arm or your leg and they put you in a cast for 8 weeks to keep the bone still, when you keep bone still, it heals, it fuses, it ossifies. So when you keep the implant still, the bone ossifies to the surface. We do that by not placing a top on it.
Okay, and so then at that point, once you put in that particular post or screw, then would you actually put the artificial tooth on, or was that something you go to a dentist for?
As a surgeon, I'm limited in how I can restore the implant, so I work with patients' general dentists, and I feel like I work with everybody in the area. And dentists do a very good job with implants. Most dentists now are implant savvy, and implants are a large part of their practice. And the technology for restoring implants has also improved dramatically. So there are really a lot of wonderful dentists doing some really great work with dental implants in the area.
And we have a question from someone who had an implant put in the Army, this person says, back in 2009, and now it's falling out.
Correct.
Is that, this person wants to know, do they have a lawsuit? Don't know about that, but is that normal for, you said these can last a lifetime.
I doubt it's a lawsuit. The mouth is a harsh environment.
Yes.
And something that's lasted 8 or 9 years, you know, that's not a typical result, but implants do fail. They're not perfect. The best set of teeth you're ever born with is the ones you're born with.
Right.
This is a synthetic solution. And so the question is it replaceable? And the answer is yes. Unfortunately, I have to see patients with failing implants.
Right.
And we can do procedures to salvage the implant, but in some cases we simply have to remove the implant and replace it. And we can do that.
Do you charge for a consultation?
We do charge for a consultation, but most dental insurances cover the cost of the consultation.
Okay.
So that is reimbursed back to the patient.
Now this person says, I only have one tooth in the front, but all, I guess, on the top, but all the teeth on the bottom.
Okay.
So what do you recommend for somebody? That's a lot of missing teeth.
That is a lot of missing teeth, and you know, it really depends on what the patient wants. If the patient wants a full set of teeth that don't come in and out, that's an option with dental implants.
Okay.
If the patient simply wants to make their denture more comfortable, smaller, more stable, then on the top we can place usually 4 implants and accomplish that goal.
Okay, okay. And do they discolor throughout time?
Sure. The implant is metal, and it's under the surface, so it's very rare that you'll actually see the implant. The crowns are usually some type of porcelain or porcelain and metal. Porcelain can stain just like natural teeth in a heavy smoker, heavy coffee drinker, but it can be cleaned.
Okay, you could bleach them just like you can bleach a regular tooth?
Yes.
Okay. And a lot of people want to know, where are you located in Mobile?
Sure, my office is on Downtowner Boulevard, so the junction of Airport and Downtowner, we're directly behind Pier 1, so easy access.
You know, another topic that we haven't gotten to that I know you do a lot of, wisdom teeth.
Wisdom teeth, yes, that's probably the busiest part of my practice.
Okay.
And so almost everyone is born with wisdom teeth. Most people have 4, some have less. Actually, some have more.
Okay,
but
more than 4.
More than 4. I've taken 10 out of one patient.
Oh, wow.
Unfortunately for him.
That's unbelievable.
Yeah.
Wow.
So, yes. But most people only have 4.
Okay.
And we do recommend those are to be removed. They're basically extra teeth, non-functional teeth. They serve no purpose. They have a lot of problems they can cause, particularly as we get older.
Well, that's what this person says. At what age is it too old to get your wisdom teeth taken out? This person says she's 30 and was told that she was too old.
No, you're never too old if you need them removed. I have taken wisdom teeth out on 80 plus, 90 plus year olds who had an infected wisdom tooth. You know, the ideal age is a teenager around 15 to 17.
Okay.
Young adult, you really want to get these out as young as you can. As we get older, harder to remove, more potential for complications.
Right.
Certainly 30 is not too old to have them removed.
Okay. And how does someone know if they need their wisdom teeth removed?
Well, you know, usually their dentist has notified them that, hey, you should probably have these removed. If they're having pain in the back of their mouth, that's possibly a wisdom tooth. They can cause crowding, they can cause gum infections because they don't always come in all the way.
Okay.
Also, they can develop cysts around them because they don't come in all the way. They're heavily decay prone. So even in patients whose wisdom teeth have come in perfectly, toothbrushes just don't get around the corner to get back there. So they tend to decay over time. They can cause cavities between teeth. They're just a hygiene nightmare.
Right.
So really, it's rare I see somebody who needs their wisdom teeth. In an older patient, if they're completely asymptomatic, I'll probably leave them alone until they have to come out. In a younger patient, it's just a good idea to go ahead and get rid of them.
And as far as anesthesia, what do you do for a person?
The bulk of my wisdom teeth patients are teenagers, and most of them will opt for conscious sedation, where we start an IV, we give them some medicine, and it's a 30-minute procedure.
Okay, that's it.
That's it.
And then you look like a chipmunk.
You look like a chipmunk, you make funny videos, you do Instagram.
Yeah, that's right, YouTube moments.
It's a process.
And as far as how long the recovery is?
Typically, for a teenager, it's 3 to 4 days. An adult can be up to a week, but we're not talking about a week where you're laying in the bed. We're talking about a week before you're eating chicken wings or a T-bone.
Right.
Back to work in 2 or 3 days for most people.
Okay, and I'm just trying to pull up some more questions. I've got the iPad, I've got the iPhone, just trying to get more questions from people. It seems like most of our questions are about are regarding people who are missing teeth, and I knew this would generate a lot of questions because so many people.
But we all have teeth, Devon.
We all have teeth, and so many people are missing them, and they don't know what to do. It's expensive sometimes for people, but boy, you talk about giving someone a nice smile or just filling in those gaps. That must be so satisfying for you.
You know, you can really see some people come out of their shell once they get their teeth fixed. They've had poor dentition their entire life. They're very self-conscious. And, you know, working with their dentist, we can basically create a smile that they can be proud of, and it really changes their life.
Right. I know you probably see that on a daily basis.
We do.
Okay, let's see if we're getting any other questions here. A lot of repetition. Someone said, what happens, what does it mean if I have a loose tooth on the top or the bottom and it's a permanent tooth?
Probably periodontal disease.
Okay.
Depending on how loose would determine the treatment. It might be restorable or salvageable, but if it's fairly loose, probably needs to be removed.
Okay. And this person, this is back to the wisdom teeth, says, Clay says, my wife was advised to take out one of her wisdom teeth from her dentist. Would it be worth it to just remove all 4 if you're just removing one?
Good question, and I get that frequently. And the honest answer is most patients would benefit from having them all out. There are circumstances where, for anatomical purposes, we may leave a tooth if it's close to a nerve. The recovery is not dramatically different between 1 and 4, depending on which one we're taking out. Of course, the lowers tend to have the highest recovery. So most of the time, after looking at the patient, their x-ray, if I feel like they're going to be back in 3 months, 6 months, a year to have another one out, I'll just go ahead and recommend they do it all at once.
Go ahead and do it. This person says, do you work on children as young as 5?
I do. We frequently work on children. You know, baby teeth start to come in around 6 months, and so I work with their pediatric dentist, and we frequently remove teeth on young children. And one advantage about having an anesthesiologist in my office is it allows me to do that in the office without having to take them to the hospital.
And that's pretty rare. Are you the only person
very rare.
in the area who has?
And the only person in the area. I'm not aware of anyone else in the state that has an anesthesiologist in their office. There could be somebody in Huntsville that I don't know about, but it really is a luxury that we're proud of, and it allows me to do some things that other people just can't do.
Right, and I think it probably removes some of the anxiety of having to go to the hospital and the whole check-in process.
Cost also.
Oh, absolutely.
A hospital for dental procedures is very expensive.
Right, okay. And you know, a lot of people, a lot of children have their teeth, you know, during a sports injury, fall out or get broken in half and things like that. So if someone, do they ever try to take a tooth and put it back in? Do you get involved in that process?
You know, yes. 20 years ago when I started doing this, before dental implants were as advanced, we would frequently place teeth and mill teeth in their cheek and reimplant them. The long-term success of that is guarded at best. Certainly for a growing child, it's a good option because you can't place an implant in a child. You have to be finished growing. And so if you lose your permanent tooth at 7, you have to wait up to 10 to 12 years before you can have an implant placed. So if you can use that natural tooth as kind of a bridge to gap that time, then it's certainly a good idea. It's pretty rare you get your tooth knocked out at 8 and you keep it till you're 80.
Okay. My daughter had her tooth knocked out, or not, well, she fell off her bike, and we had to remove the tooth at age, I think she was 3. And we were like, oh no, we're going to have a snaggletooth little girl at age 3. But they said, don't worry about it. It's just the baby. They ended up having to pull it. It's just the baby tooth.
You never do that to a baby tooth.
Right.
You just throw baby teeth in there. We put them under the pillow.
Right.
Scary.
That's what we did.
Permanent teeth are a different animal. We do try to salvage those.
Well, you know, somebody asked us, I was not about to entertain this thought because she was 3 years old, but someone said, why don't you have a fake tooth put in? She's only 3. She's not going to lose that tooth till she's 6 or 7.
Sure.
You know, you just don't do that, do you? I mean, that's to me not necessary.
Most people don't, because the child is not conscious of it. It's more for the mom, and if the mom's okay without it, then we typically don't do that.
Okay. All right. Let's see. Let's see. Root canals, fillings. Do you do root canals?
I don't do root canals. I do work with endodontists, which are root canal doctors, and I do what are called apicoectomies, which is basically a surgical root canal on a tooth that has failed traditional root canal treatment.
Okay, so you're sort of the last line there.
Yeah.
Okay, yeah. And let's see, someone wants to know the cost of a full set of implants. That would be very expensive. That's a lot. Do you ever do a full set of implants?
Believe it or not, frequently. It is an investment.
Okay.
But you don't have to replace an implant for each tooth. So we're born with 32 teeth. If you take out the 4 wisdom teeth, most people have 28 functioning teeth. You would never need 28 implants. Okay. Typically, you can restore an entire maxilla or upper jaw with 8, and an entire mandible or lower jaw with 6.
Okay.
And so you don't have to have as many as people would think.
Right, right. Well, you're getting a lot of compliments on here, saying that you're a great doctor. You did somebody's jaw surgery, you did the wisdom teeth surgery, so certainly a lot of compliments on here.
We try hard. We want people to have a good experience. We want them to feel comfortable, and heaven forbid they have to come back. We want them to feel confident that they're going to get good treatment.
But one thing that you've stressed in our conversation over the last hour or so is trying to make these last for years, if not a lifetime.
Correct. You know, I've placed, I don't know, probably over 10,000 implants, and 99% of those implants are going just fine.
Okay.
So that's my personal success rate, which means I have had failures, but they are rare.
Right.
And so I really stress to patients that if done properly, these have the potential to last a lifetime. dentistry is not perfect.
Right.
No dentistry is perfect, but this is pretty darn close.
Yes. Okay, this person asking about IV sedation. Yes, you do that.
We do that frequently.
We've talked about that already. Let's see. Do your patients have the ability to get 2 implants the same day all teeth are removed?
Correct. So
you
on
can do that
the
on the
lower
same day?
jaw, for example, a patient who has a failing lower dentition who's going to go from bad lower teeth to a denture, we can take all of the lower teeth out, place 2 implants, actually even have their denture placed immediately to just wear as a traditional denture in the same appointment. And that's a fairly common procedure in my office.
Okay, wow, that seems like a lot of work in one
You know,
one
it's
day.
about a 45-minute to an
That's
hour
it.
procedure. It doesn't take long.
Wow,
When patients are comfortable and their anxiety is gone, I can work very quickly.
yes. Let's see here. This is a little bit detailed, but this person wanting to know about the drug Fosamax. And I believe is that a bone hardening drug?
That is a drug for osteoporosis that millions of women are on. There are several different similar drugs such as Prolia, Beniva, but these are used to harden the bone. They work on the little cell called an osteoclast.
Okay.
So you have osteoblast and osteoclast.
Okay.
And the clast cause bone to break down. The blast make bone, so it turns the clast off, so you just keep making bone. And the theory is that it increases your bone density. There are different types of bone in your body, believe it or not. In your jawbone is called mesenchymal bone. We want Fosamax to go to your hips, your back, your long bones, but it gets absorbed rapidly in your jawbones where it's not needed. Soaks it up like a sponge. When you have a tooth extracted, you're actually exposing bone when you remove the tooth. The socket of the tooth, there's bone exposed. Part of the healing process is removing that bone to allow the soft tissue to cover it. That gets turned off, and so there is a possibility for a non-healing wound. It's called bisphosphonate-induced osteonecrosis. It's rare, but it's possible. It's a problem, and it's one that unfortunately we have to deal with quite frequently now that so many ladies are taking this.
Okay, all right. So that's definitely something
Something we do.
that you have to deal with.
Yes.
Let's see here. What to do for an abscess? But that sounds like, is that something you deal with a lot, or would that be more?
Absolutely.
It is?
In fact, I had a child in my office this week who had a fairly significant life-threatening infection.
Wow.
So abscess teeth are a common part of life,
Okay.
and they have to be treated. They can be emergencies. Most of the time, they're an urgency. But you certainly, if you have an infected tooth, it needs to be dealt with. And there are 2 options. You can do a root canal or you can do an extraction. Most of the time, once they've gotten to me, they're beyond repair.
Okay.
So we extract the tooth, we drain the infection, and then we do antibiotics as a last resort. It's kind of a misnomer that you do antibiotics first, but you remove the source, then you treat with antibiotics, and they recover rapidly if done properly.
Okay, so as far as if someone feels they have an abscess, would they call you immediately, or did it start with your dentist?
If they have a dentist and they want to start there, that's appropriate. If they don't have a dentist and they're concerned, they can call my office and we'll be happy to see them.
Okay, let's see if there's any other questions here that we haven't addressed. Let's see here. If you have a question out there, we'll see if we can get it in to Dr. Chris Mullenix, who is joining us now on Facebook Live. I think we've pretty much addressed all of these questions. Some of them are just very detail-oriented that perhaps they could call your office.
Sure, be happy to see them for a consultation.
Okay.
You know, no referral is needed to see me.
Okay.
So anyone that wants an appointment, all they have to do is simply call our office.
Okay. Let's see. I think we've pretty much gotten to. Do you take Medicaid?
You know, I do not take Medicaid, but I can find a person that does if that patient needs an oral surgeon.
Okay. All right. Well, is there anything else that you would like to add to the conversation that we might not have?
I just appreciate you having me. This has been very rewarding, and I hope people will give us a call and we can help them with their oral surgery needs.
And this has just been such an eye-opening experience for me to talk to you about dental implants and all the things you can do to help people who might think there really isn't anything out there for them.
Technology and the time is amazing for dentistry, and there's a lot of things we can do to make life better.
All right. Well, Dr. Chris Mullenix has been our guest today on our first The Doctor Is In segment here on WKRG. Thanks to all of you for joining us on Facebook Live. And people want to know here, do you have a long waiting list to get in to see you?
No. We'll get them in as quick as we can.
And do you take United, Concordia?
I believe we do. They're happy to call my office. I have a team of insurance ladies that are happy to help.
Okay. I know there's the insurance industry is changing by the day,
correct.
so I know you probably can't even keep up with all of it.
I can't keep up with the insurance, but my
Alrighty.
girls do.
Thank you so much,
Thank you,
Dr.
Devon.
Mullenix. We appreciate it. And thanks to all of you for joining us on Facebook Live. And you can give Dr. Chris Mullenix a call here in Mobile. His office is located on Downtowner Boulevard, and he'd be glad to help you out. Thanks so much, everybody. Have a great afternoon. All right, so we're